Is this an inflammation? Yeah, is this an inflammation, or is this a construction, or is this a destruction? What is the disease? What is this disease that has to be treated? So the knowledge of the disease is the most for a physician. And this can be understood by the miasm, what we are dealing with. So in homeopathy, the importance of miasm is this much. Sky is the limit. And one more importance for July 2nd. What is that? One more memorable day. Again, the death anniversary of another doctor, Dr. Reiki Gerd Hammer, who has given us the German new medicine. Both of them are Germans, Dr. Samuel Hahnemann and Dr. Reiki Gerd Hammer. Both of them are Germans. And what is the importance of Dr. Hammer here? Yes, whenever Vijaykar sir has cracked a case at our SAPH Plus in Mumbai, he used to crack cases like that on the stage, all genetic malformations, all the genetic cases he will be dealing there. Child's eyes like that? Why is his chest so flat? Or why is his abnormality of the physique? Just by looking into the abnormality, Vijaykar sir used to come to the point and to ask the question point blank to the mother. As young budding homeopaths, we all want to have such kind of a knowledge. We all want to know what questions to put forth. We all know that there is a mind for the pathology. We are dealing the pathology, of course, but then how to crack the pathology? We are not allopathic doctors. We are not treating the result. We are not treating the inflammation with or the construction or the destruction without knowing the mind of the pathology. What has reached, or finally the disease has shown up in the form of an inflammation or a construction or a destruction. These are the only three possible changes in a cell. But then why did this change happen in the body? That is the question. What has made this disease? This is only the disease, the inflammation or the construction or the destruction. We are not treating that. We are one step ahead. We want to know the cause behind that. We want to know the mind behind the pathology. We strongly believe that without some thought process happening, without some delusions or some false perceptions, no changes can happen in our cell. And the cells constitute the human body. So without the cells getting treated, the human body cannot be treated. Without the mind getting treated, the disease can never be approached. So what is the approach for every disease? You should know the mind. It is so simple. You should know the mind of the pathology. Then who gave this mind of the pathology? That is the greatest contribution of Dr. Hammer. He has given us the importance of right side and left side. Why only right side? Why left side is paired? Why the disease is not coming on the left side? Why it is the right eye? Or sometimes why it is the left side? Why the right side is not affected? Or why both the sides are affected? Why only the brain is affected? Why only the leg is affected? For any disease, anything can happen, no? Yeah, of course, according to the organs, the organ of pathology is different. But then for every organ, what is the mind behind every organ? So every organ, every cell in the body, the 70 trillion cells in the body, every tissue, every organ is controlled by the brain. It is controlled by the brain. But then controlled by which area of the brain? That is different from endoderm to ectoderm to mesoderm. When a cell is formed, when a zygote is formed, it becomes a bilaminar, and then later on after multiplication, it becomes trilaminar, which means there are three germinal layers: the endoderm, ectoderm, and the mesoderm. Eventually, the mesoderm also has got an old mesoderm and a new mesoderm. Yes, and these separate organs which are derived from the separate germinal tissues are controlled by separate areas in the brain. This was found out by Dr. Hammer. This is the importance of Dr. Hammer here. And these are our young budding homeopaths. We all want to know what questions to put forth. Okay, the patient is coming with a kidney trouble. What questions to put forth? Which area of the kidney is affected? And that portion is controlled by which part of the brain? Yes, and right side or left side. Finished. This much a doctor should know, a homeopath should know, or a higher thinking homeopath should know. Yes, the pathology alone is not enough for us. The miasm behind that, the genetic change, not the genetic change, the cellular change is needed for us. That is shown by the miasms. One step ahead, what is the mind behind the change in the cell? that is given by Dr. Hammer. And these are all interconnected by Dr. Vijaykar sir. Yes, embryology. Through embryology, he had given us the chart of suppression, the various layers of suppression, the ectoderm, endoderm, and all. Even much behind it, much before, even before he knew the theories postulated by Dr. Reiki Gade Hammer, Vijaykar sir used to talk about the embryological derivations, the ectoderm, endoderm, mesoderm, and he has formed the chart for the suppression for us to look into the this one, the Herring's law. Looking to the Herring's law. How do we see the Herring's law in our case, in our daily practices, in our daily practice? By the layer of suppression. Whether this is going on, whether the disease is growing or whether the vital force is becoming more and more active, whether the disease is getting better day by day, we have to elicit that mathematically through the Herring's law. And we used to study about Herring's law in our colleges, but then we never knew what it was until Vijaykar sir has correlated everything, correlated anatomy and the genetics and the stem cell therapy, everything he correlated there, and he gave us the theory of suppression. And by knowing the three germinal layers, we now came to know which all organs are derived from which all germinal layers. And now we know what is meant by suppression and what is meant by cure and how to elicit Herring's law daily in our practice. And with the help of the theories given by Dr. Hammer, now we know the mind of the pathology. Now for you youngsters, where will we get this mind of the pathology? So it is nothing but German new medicine. German new medicine. And here it is like, I shall type it down here. If you want, you can go through that website, learninggnm.com. This will all in small cases, okay? So this will be very good for all the youngsters to ask, to understand more about the pathology of the disease. You should know the pathology of the disease in front of you, right? Knowledge about the disease, very important for a homeopath. And what are the cells involved and what are these cells derived? Are they derived from ectoderm? Are they derived from endoderm? Are they derived from mesoderm? Yes. And if they are, yeah, and which part of the brain is controlling them? So when you do a CT scan, you know that certain areas in the brain are hazy. Maybe on the right side, maybe on the left side, maybe in the cerebral cortex, or maybe in the cerebellum, or in the motor cortex, or in the maybe in the sensory cortex, or in the post-sensory cortex. Where is, or in the brainstem? Yes, or in the cerebellum. Where is that haziness? That is in German new medicine, it is known as the hammer foci. Hammer foci. So, which means that part of the brain is now stimulated, or that part of the brain is now suffering from something. What we generally say, okay, these are all glial cells. Some tumor is there in the brain. We identify it in that way. Okay, some tumor is there in the brain in that particular area. But when that particular area is affected, this area is controlling some other organ in our inside, in our body. What is that organ? Okay, so by looking into the CT scan of the brain of a patient, we can analyze what are all the things this patient has undergone in his body. So that is the journey of the disease. So we know that what are all the pathologies which this patient had undergone just by looking into the CT scan of the brain. So these theories are given by Dr. Reiki Gade Hammer. So young doctors, whenever you are doing the case taking, whenever you want to know what is the pathology of the disease and which part of the brain is controlling that, or even you can leave that part. As a homeopath, we are not interested in which part of the brain it controls, because that is not needed for us to prescribe. But then we want to know the mind of the pathology. That is also given there in this website. What are all the thought processes which are happening? What thought process will give rise to such kind of changes in the cells? This is given by Reiki Gade Hammer. He was an oncologist by himself in a hospital at Germany. And he started advocating this after he himself developed a left-sided testicular cancer after the death of his son. So then he started calling back all his patients, and he did a study upon them of more than several, I don't know, more than 1 lakh or 10 lakh. And then he had come to this arrival that without the mind getting affected, without a profound loss, or without a profound grief, or some conflict, a disease can never occur. As long as everything is smooth in his life, the patient is happy, there is no disease in his body. So this is the mind of pathology. So having said that, great. So tributes to Dr. Samuel Hahnemann, who has given us the theory of similibus as well as the miasms, and tribute to Dr. Reiki Gatehammer, who has given us the mind of pathology. Now let us go into our studies, that is the My Assumption of Miasm. Thank you. That is given by Dr. Prafful Vijaykar, our guru mentor. Once again, welcome you all to our reading club, and deep gratitude for all of you for investing time and giving me the space to have this book read. So now we are into reading that is page number 106. We have been dealing with the genetics. Yes. We predictive homeopaths, we are dealing with the genetics now. Yeah. Without knowing, why do we want to, all the homeopathic doctors want to know about the genetics? There is no end to learning. There is no end to learning. If you are a complete doctor, you will want to know everything. We will want to know every cell of the body. We are dealing with patients, and without knowing his genetics, then what are you treating? What are you pretending to be treating? Are you treating the cold, or are you treating the man who are having the cold? Yes. That is the question in homeopathy. We are always one step ahead. We cannot treat the disease without knowing the mind of the pathology, or without knowing the who you are treating, without knowing the human being who is sitting in front of you. Yes, that is why we are now in this chapter 13, that is the miasm defense and genetics, page number 106. So in the last class, we talked about the physical structure. Okay, every physic is different from person to person, and that is determined by the genetic code. And coming to the mental behaviors, that is also decided by the genetic code. And this is the reason why the same medicine for cold cannot be given for 10 other persons. Why every fever is different, and why fever for the same person is different every time. All these things are governed by the genetic, the response of the patient according to his genetics. And this is the reason for the individualization as well. In homeopathy, we have got 100 marks for individualization. Without individualization, we cannot prescribe. And in the last class, we have dealt with the certain innate characteristics. Why are certain character of the timid variety? Why are certain character of the bold variety? Now, what are all the timid behaviors? One thing is to escape, yeah, and then to resign, to be mild, to deal with no confidence in oneself, or to be bashful, or to hide. See, all these things are the defense mechanism of certain persons to face the hostile situations. Hostile situations are there, and then we cannot go and fight everywhere. At certain places, we will have to go hiding. We will have to go we will have to escape, or we will have to be bashful, or we can, where we can fight, we can come out with fighting. Certain people will be fighting everywhere. Yes, certain people will be bashful everywhere. So which are the constitutions which are bashful, which are the constitutions which are mild? We were dealing with such things. And where were we in the last class? We were at the escape attempting. So which remedies will be escaping? In the last class, we talked about the timid remedies. The timid remedies, they only will escape, no? Otherwise, they will stand in front. They will stand in the front and fight. So these people who are escaping are basically of the timid medicines in our materia medica, or they are having mania, or they have lost their control of the brain, or the control is what the neurotransmitters are changed now, and that is why they are behaving in certain ways. So escape, there are certain interesting things to be known in our day-to-day behavior for genetic constitutional simillimum. You can always make use of this rubric: escape attempts to from the family. Escape attempts to from the family. So this is not a a thing which we see in mania, etc. This can be seen in our day-to-day practice, and this rubric will help you to guide towards the genetic constitutional simillimum. Let us discuss about that. So escape attempts to from the family. The main remedy is Lycopodium, sepia. Very good, Sophia. Yes. Ammonium carb, natrum silicatum, Naxvomica, phosphorus, Staphysagria. So you know why? Why sepia? Why sepia? Sepia wants to escape from the family. Sepia, indifference. Indifference. Very good. But then what kind of an indifference is that? Is it an indifference to the personal appearance or indifference to the things around? This lady sepia is having an ennui. What is meant by ennui? Overburdened. Yes, Sophia. Overburdened with, that is it. Overburdened with family responsibility. And that is in other words known as ennui. Ennui towards life as such. Because this lady is
when question gets angered.
Yes, overstretched. This lady has been overstretching herself to take care of the entire scenario of the house. The relatives, this one, that one, everything. This lady has to run around and see to it. So finally, eventually, she is having this boredom. Ennui, that is boredom towards life. Enough is enough. I don't want to live with a syphilitic thing, whereas escape is the psychotic miasm. So this lady, before reaching the indifference to the highest, or before even having that, I don't want to even exist in this world, no, like existence miserable. There is only sepia there. So, before coming to the existence or life or death question, this lady will be having a phase of escape tendency, to escape desire. Let me go out of this house. There are many ladies who will come to the clinic and say, they will narrate all this case history and they will say at the end of that, I just want to leave this place. I just want to leave my family and run away to somewhere. I want to sit in the Himalayas. Patients used to say that. Many ladies have said that. I want to escape from this situation because people are taxing me, and how much can I bend? Yeah. Lycopodium. Lycopodium, when he thinks that he has lost the power in the family, when he thinks that the children are grown up, when he thinks that the children are not giving him any respect, how can I stay here then? Estranged from the family and wants to escape from the family, and nobody is asking me anything, whether I exist here or not. I have been ruling this house, no. Now the people are not giving me any preference. They are not discussing matters with me. So this is the attitude of Lycopodium, and he wants to escape from the family. Ammonium carb, natrum silicatum, Naxvomica. See, all these are anyway timid but angry remedies. Angry remedies. They are all fed up. They are all positive people. What about ammonium carb? Is it positive or negative? It is very positive. Ammonium carb is a positive medicine. It wants to do, it is ambitious, but it will be failing. Somewhere it will feel the shortness of the muscles, shortness in the mind. Somewhere the performance is shortened. I am not up to the mark, but then ammonium carb will be reading or ammonium carb will be working, it will be diligent, but then it has got that rancor on the face. Somewhere something is wrong. I am not able to achieve, and always ammonium carb will be irritated and angry, and it will want to escape from the family. See, everybody are asking me something to do. I don't want to stay here. Similarly, Naxvomica, doing everything, zealous, doing everything, and finally, eventually, Naxvomica is an achiever also, no? Whereas ammonium carb is just second or third to achieving. Ammonium carb, there are achievers in ammonium carb, but then that rancorness will be more in ammonium carb. What is that rancorness? Some anger and some aversion to, yeah, that is the phase of ammonium. Yes, some irritation, some aversion kind of face expression will be there because ammonium is never satisfied. Just like China, ammonium is never satisfied, always complaining also, never satisfied about himself. Ammonium Kali will be never satisfied with the performance of others, whereas ammonium carb is a kind of an introvert. It will be having a self-questioning. I am doing all these things and still I am not getting results. I feel shortened somewhere. That is the feeling of ammonium carb. Natrum silicatum, all sorts of confusions and identity conflict will be there for natrum silicatum. Naxvomica, phosphorus. Phosphorus is a very sweet remedy. How can you expect phosphorus, a talkative phosphorus, a sweet talking phosphorus, loving phosphorus? How can you expect escape attempts to from her own family, from his own family in phosphorus? Eventually, our phosphorus also becomes indifferent in the syphilitic phase, or when the phosphorus becomes old, or when the for old ladies, no, like who have been dealing with everything, whoever comes to the home, they will be extrovert and they will be socializing so much. And at the end stage, in the last stages of their life, they will be indifferent. And they will say that, I don't want to stay with you people. Yes. Staphysagria, again, you know about lot of mortification, vexation, and indignation. Staffy will want to escape from the family because Staffy needs respect. Staffy needs respect. So if there is no respect, then Staffy will make all such dialogues. I don't want to stay with you people. Yeah. Then there is an interesting rubric, escape attempts to in puerperial mania. How many of you have seen puerperial mania? What is puerperial mania? After delivery, after parturition, the lady goes into some kind of a psychosis, postpartum psychosis. Postpartum psychosis, and the patient is running on the road. Escape tendency to. That can be, we can tackle that with stramonium. What potency? High potency. And is it easy to tackle a stramonium, a running stramonium? Very difficult. Very difficult to tackle stramonium. Yes. See, how can you first of all administer the medicine to such a violent stramonium? Stramonium is violent because of fear. Yesterday we talked about that. So this stramonium will be running around by with shrieking. What is that rubric? Escape attempts to with shrieking. Only one remedy in our rich materia medica, that is stramonium. Shrieking, the lady will be running around. Not so easy to catch hold of that lady. Why? Because it is restrained with difficulty. Escape attempts to with shrieking and restrained with difficulty. Only one remedy, that is stramonium. So can you imagine the picture? Having a baby at hand. The lady has, I have seen cases like that. But then I did not do anything at that time. It was all, yeah, some story. I did not have to treat it. That's why I did not. But then she was taken to the mental asylum. She threw back her child. The child was born with a heart problem. The child was a blue baby. And this lady was coming from an affluent family. She could not withstand the kind of mental tortures in this family. Her husband was an inebriate. He was an alcoholic. And he will be coming home late. Her expectations were not satisfied. And eventually she conceived, and the child was a blue baby, underweight. What will this girl do? This sweet, nice girl, timid girl with curly hair, just like Sai Baba, she will be. Curly hair, thick hair, thick hair. And she became maniacal after delivery. She threw away the child into a puddle of water. It was raining heavily here. She threw away that child and then she ran on the road with so much of energy. Like all the gents, all our friends, family members, everybody ran behind her in that torrential rain. And she was just like that, no, with a push, she was pushing away everybody. She was having so much of energy. These people could not subdue her. That is, what is that? Shrieking and restrained with difficulty, mania puerperium. Only one remedy, stramonium, stramonium, stramonium. And she was somehow tackled and put into the car and straight away driven into the mental asylum. At that time, we never knew about stramonium. We never had the guts to deal anything with homeopathy at that time. Maybe stramonium 50m would have been sprinkled on her or somewhere poured on her, or I don't know, or maybe upon her wrist or upon certain parts of the body, because the patient was out of her mind. So now coming to escape attempts to during pregnancy. The lady knew that she is pregnant and she wants to escape. Beraita, no? Beraita. Beraita and pulsatilla. Somehow, because of some fear, they don't know what to do. Oh, I am pregnant. I don't know what to do. And they want to escape the situation. They want to escape the situation. In cases of repeated abortions, escape attempts to They will escape from the pregnancy by having. You can make use of this rubric there, Beretta Carb and Pulsatilla, for cases where there is abortions in the history. You can always think, why was that? Then Beretta will not give a proper answer. And Pulsatilla will say, I had all sorts of confusions and fears, and I did not have support. My mother was not there to help me. My husband was away. So, or he was not there to help me. Yes. So Pulsatilla needs all these helps and consolation, no? So she will automatically go into an abortion. Yeah, MTP and all need not be done, DNC need not be done, or any tablet has not to be taken. Just like that, by her physiology itself, she will undergo an abortion because she is not ready for that. Remedies, right? Who will run away on the road? All the drug remedies. Belladonna, hyoscyamus, Naxomica opium, Veratrum album, Cuprum, Merck. Merck can be violent also. Belladonna can be violent, is violent. Belladonna is violent. Veratrum, yes, violent. Cuprum, Naxomica, opium, bryonia, and rustox. Runaway in mania will be only the drug remedies, belladonna, veratrum album, but cuprum is also there. Cuprum is rather a convulsive remedy, no? Like with epilepsy and chorea and convulsions and the nervous system and the neurotransmitters. Yes, that is how it happens in cuprum. Anyway, a nervous remedy, cuprum is. Now there is another good rubric which you can make use of, which you can relate to. That is escape attempts to from the window. From the window. You would have seen many suicidal cases who have jumped out of the window. Huh? At the 4th or 5th floor or at the 7th floor of the hotel or in the hospital. Sometimes the patient will jump down from the window. Escape desire to, escape attempts to from the window. Which are all the medicines? That is aurum, belladonna, bryonia, calcarea silicata, gelsemium, and valeriana. Bryonia, okay, that is want to go to home, no? That is the only thing which I know about bryonia. And I don't know this escape, this argentum nitricum is also there. Okay, thank you, Atira. But aurum you can always relate to because aurum is a great suicidal remedy. Suicide can be because of melancholy or because of pain in aurum or because of some esteem loss. Esteem loss can lead to the melancholy and eventually he is a lost person and he will think that let me die, let me commit suicide. How? By executing everything properly. No, it is a planned death only for aurum. Aurum will not jump out of impulse. Whereas argentum nitricum can jump out of the impulse. Yes, Adira, argentum nitricum will never jump, okay? Argentum nitricum is only having that impulse. Impulse to jump is there, but it will not jump. Those people who want to jump are the ones who want to commit suicide. Like aurum will jump, 3 marks for aurum. So why is aurum jumping? Okay, after writing down everything or after completing the diary or after doing all the bank transactions or putting the balance equally to all the children or to taking care of the spouse, making arrangements for all such things, and he will decide that it is time for him to commit the suicide. How? That also he will think and plan. Okay, when everybody are resting, I don't want to I don't want to disturb others, no. So when everybody are sleeping, I will be climbing up and then maybe I'll jump. In one jump, I should die. So that will be the aim of aurum. So aurum is so what to say, pain from maybe in the hospital wards, in the cancer ward and all. Sometimes you can see like that when everybody is sleeping, this patient tolerating the pain. Eventually he knows that there is no escape from this, so let me escape from this world itself, slowly climbing upstairs and then jumping down. That is a single remedy. Delirium during, suicidal throwing windows from delirium during. That delirium can be from pain also, delirium from pain, and aurum is the single remedy there, jumping out of the window from pain. Jumping out of the window and committing suicide from fear. Only one remedy. From fear. That is arsalb, arsenicum album. How? What fear this arsalb has? Not the fear of death here. What fear is this? Fear of maybe police coming to arrest me. I have not followed the rules. I have made some mistake there in the papers, and some transaction went wrong, and there was a big loss for the company. And now the company has informed the police, and they will be thinking that I have withdrawn or something. All sorts of thought process are happening in the mind of arsenic album, and this fear and this shame cannot be tolerated by ourselves, because ourselves is always of good morals and having a very gold-headed cane. No, it has got that recognition, a good recognition in the society. Ourselves cannot tolerate that. Rather, let me die. So that fear of getting arrested is also there in ourselves. Headache from suicidal, throwing out of the window. Headache from that you all have to answer. Which is the highest headache remedy? As if the head will blow away. Sunstroke. Yes.
Clonana.
Yes.
Clonine.
Yes. Glonoid. Everybody got it. So because of the headache, certain people will want to jump out, and that will be like, you can think about glonoid there. So now all the interesting things from the escape attempt to rubric are over. Any doubt? Can we go to the next rubric? Are you all okay? Yeah, are you all okay to go to the next rubric? Yes. So the next thing, all these things are the characters given to us by the genetic code, by our genetic code. So escape tendency to, or the quality to resign, very, very important rubric. Discourage to resignation. In Schroen's repertoire, you have around few remedies, and in complete repertoire, you have even more. So in the Schroen's repertoire, it is written as mind resignation. Okay, but then in complete repertoire, it is given as mind discouraged to resignation. These rubrics are all the favorite rubrics for Vijaykar sir. He used to tackle cases by looking into this rubric. Aarti is saying something. I have seen a man who had a curable disease, but perfectly completed everything, even money and things for funeral, for functions of 16th day after death programs, and progress to his death even when his daughter was a doctor. Is it suicidal, or he progressed to death? Is it? It was not suicide. No, he did not jump and all. It is death presentiment. It is death presentiment of, yes. And he was mentally ready. He was mentally prepared. So that is the guts of Aurum. He knew that he is going into the death. Before that, he wanted to keep everything ready. He did not want to make others waste their time. Yeah, that is very important for Aurum. So discourage to resignation, very important, interesting rubric, very useful to tackle autoimmune cases. We have a rubric for this. Settle affairs with. That is petroleum, right? Death presentiment, settle the affairs with is petroleum. Yeah. Okay. Yes. But then you can always think about Aurum also there. Petroleum will be kind of maybe in the last 2 days or maybe in the last week when the doctors have declared petroleum. When the doctors have declared that you can take him to the home. Death presentiment of rejoice and gives direction to about funeral. That is that stramonium? Sai Narendra? Yeah, is it stramonium? Yes. Death
Yes, ma'am.
presenting of, yeah. Rejoice and gives direction.
Death presentiment of rejoice and gives directions about funeral.
Yes. So that is stramonium in the mania phase, or maybe he will also be involved in keeping or arranging things for his own funeral. All these things are foolish. All these things are maniacal. Aurum will never behave that way. Aurum, like he was very perfect. Aurum, like he was very perfect. Yes. Aurum will be, even before the doctors have declared that nothing can be done, nothing more can be done, Aurum will use his own intelligence, and Aurum will rather think that every man has to perish. I also have to dust every man must. So let me also perish, and this is the best time for me to die. This is uh, okay, let us not go out of the channel. So, Aurum, no, like that is the suicidal thought process of Aurum. Even if maybe the patient can recover also, but it is the choice of Aurum to die. Whereas petroleum wants to live. Petroleum does not want to die. But then the doctor or everybody say, okay, the patient understood that he is not going to live anymore. Then he wants to rather complete all the forms or whatever, everything, he want to give the ATM PIN number to his children, everything he wants to do. Petroleum runs around to settle the affairs. Or maybe the doctor would have predicted that you will have only 1 month more to live or only 6 months more to live. So this would have been declared by the doctor, whereas petroleum does not want to do the suicide. Aurum decides, okay, Swachanda Mrityu, no? I want to die after doing so and so. Whether it is with disease or without disease, I don't bother. I have completed my life. Now it is time for me to go leave this world, rather. Let me not make any disturbance to others. So this will be the attitude of Aurum. So death presentiment of is there for Aurum also, but then now this is the comparison with petroleum. Okay. Aurum is gold now. You cannot underestimate Aurum with petroleum and all. What is petroleum? Coal, charcoal. So that difference is always there. So now discouraged to resignation. Who will be discouraged? The timid people will be discouraged. So certain people know, like who are always obeying and yielding, like the typical housewives, Bharatiya Nari. Alumina, natramure. These are the two remedies which are there in another rubric, like head belongs to other. Like the husband will decide, the head of the family will decide, the father-in-law will decide. And this lady will have to run around. How? Hurry, always. And accomplishing nothing. There will be mistakes. Everybody will be shouting from here and there. I want tea. I don't want tea. I want coffee. I want little sugar. I want more sugar. What will this lady do? Nobody will help her. Confusion, exactly, Atira. Confusion. And this lady, okay, she wants to do also, no? She is very yielding and very loving. How will be alumina, the face, how the alumina face will be? The ammonium carb face, it will be having that rancor. The daughter-in-law will look at the husband, look at the mother-in-law, father-in-law and all. And that rancorness, that face will be produced by ammonium carb. Whereas alumina, sweet, smiling face. Yes, Papa. Yes, Father. Yes, Mother. And she wants to give it also, but she will be mixifying what? She will be mixing salt instead of sugar. Alumina will make mistakes, no? In the hurry. Coffee powder instead of tea powder instead of coffee powder. These mistakes happens, no? In our life also sometimes it happens. 10 people want 10 different things, like homeopathy, individualizing there. And what alumina can do? Hurry, and mistakes. And what she will get in turn? She will get scolding, she will get mortified. And alumina will think that resignation, resign, discouraged to resignation. Come on, I cannot do. What will happen? Parkinsonism can happen. Trembling of the fingers can happen. The moment she takes the kettle will start vibrating. The moment she takes the spoon will start vibrating. The knife will start vibrating. Why? Because of the confusion, because of the resignation. No, come on, I cannot do this. I was doing all these years, but now I cannot do this. I am confused whether to take tea or coffee, whether half teaspoon sugar or 1 teaspoon sugar. I'm confused. I cannot do this. That is the resignation of alumina. And there can be trembling of the fingers. Now, what about natramure? Natramure is that discouraged to resignation is because of the hurt feeling. Yeah, emotional. So that is why natramure will not it has got all the resentment, it has got all the anger, all the hatred, everything is there inside natremure, but then it will not show out, rather it will resign. It is discouraged and it will resign in front of whoever is giving love. Natremure knows that, okay, uh, uh, whatever this person is doing to me is not the right one. It's not, this is not he has to, this is not how he has to behave to me or to behave to my mother, or always we are put down. But the natremure will adjust and go, because it is very yielding, because every relationship is very important for natremure. That is why whoever is shouting at them or blah blah blah, natremure will silently, all the anger, resentment, everything is there. The grudge is there, the brooding is there, the dwelling about the past occurrences is there, the silent grief is there, and the crying inside the bathroom. After covering everything, after covering every window, natremure will be crying, or into the pillow, the natremure will be crying. But then it will be discouraged, and it will be resigned. So let me obey this, or let me undergo this one. There is no other way for me. I cannot leave this home, because I cannot leave my loved ones, because I may not get another loved one, and this is my one-to-one also. No, I cannot leave this one-to-one, because I will not get another one-to-one, because natremure is very, very poor in getting the relationships. Phosphoric acid, picric acid, nitric acid, three acids. Acids means weakness. Phosphoric acid, physical weakness. Mental weakness converted into physical weakness. Picric acid, brain fat. Physical weakness converted into mental weakness. Picric acid. Yeah. So coming to phosphoric acid, some sadness, some ailments from disappointed love, some indignation, mortification. Phosphoric acid becomes so sad and so weak. It will become sleepy. It will sleep like a log, just because of one scolding, or just because of something happened in the home, not according to the wish of phosphoric acid. It became so weak, because it was affected mentally. And it was just like that on the sofa. She just lay down like that, exhausted, very good, and slept off like a log. That is phosphoric acid. Again, that is a great remedy for resignation. Vijaykar sir has tackled many cases by using phosphoric acid. Discouraged to resignation, because it cannot fight back. It is so weak physically and mentally. It is so weak. It cannot withstand. So it has to resign. No, there is no other way. It cannot stand up for herself. Picric acid, brain fag, and ailments from shock, and that going into some physical disturbances, or physical disturbance going into mental. No, that is picric acid. Physical disturbance means what? Picric acid can be compared with fluoric acid. Fluoric acid is the most strongest acid in our materia medica. Fluoric acid gens, like how they are jumping from one job to another, and they are so enthusiastically working, and the buoyancy of the fluoric acid, everything will be shown there, full of energy, fluoric acid. Picric acid can be ladies' version of the fluoric acid gens. Like fluoric acid, no, like it will jump from car to car, it will jump from company to company, it will jump from ladies to ladies, and picric acid can do the same thing. Like they can also jump from men to men. Picric acid also has got that extreme sexual interest, and unsatisfied, unquenched sexual desire is there for picric acid, and it can do the same thing what fluoric acid does. Picric acid is generally compared like the female version of fluoric acid. It can be given for gens also. Vijaykar sir has given enough examples of picric acid, where he has given the confusion happening after a physical assault, after something physical happening to the patient, after some accident, some physical accident, some fall or something, or something happening, physically happening, and the patient went into brain fog and confusion and shock and not able to remember, and memory loss. Memory loss after something physical happening is the picric acid. Nitric acid, nitric acid, very poor remedy, very, very timid remedy, yielding remedy, loving remedy, nursing the sick people throughout the night at the cost of this patient's energy, not sleeping, taking care of the patient very nicely, like a home nurse. She will not be a home nurse. She will be the mother of the house, but then she compromises her sleep, night watching, how many days, not 1 or 2 days, for years together, if there is a paralysis patient, or if there is a Parkinson patient, or if there is a chronic ailment, somebody is there, some senior people, or some child, no, like spastic children in the home, this nitric acid will be nursing, and becomes lean and thin and emaciated, and it will be having all sorts of anger and resentment in the mind. Why nobody is helping me, or I don't have a helping hand, I want to sleep, I am also a human being, come on, listen to me, but nobody hears her. Ultimately she will have that bad energy in the mind, that is the anger, that is the resentment, that is the hatred, that is the revengefulness, and the vindictiveness, and the unforgiving to any apologies. All these things happen. This is the chronological order of nitric acid going into syphilitic miasm and undergoing all the syphilitic torture, like the cracks everywhere and in the mucocutaneous junctions and all. Nitric acid also is a resignation remedy. Resignation means, come on, I cannot fight. All this resentment, anger, everything is there inside the mind. Inside the mind. Recently, one of our senior doctors have told a case of some disease. I don't know what disease it was. It was not an XYZ disease of nitric acid, okay? We will never think about nitric acid to that particular disease. But then genetically, this person was made as a nitric acid. He was all smiles. And the typical picture, what we expect is hatred, revenge. There is no hatred and revenge on his face at all. He is such a socializing person, very nice person. When our dear senior doctor delved into his case history, he said that I have underwent all these scenarios in my past, in my life, and what happened? How did you react? Okay, I suppressed everything in my mind. Now I don't mind about that. Then this doctor asked, "Will you forgive them?" He said, "No. How can I forgive him? I cannot forgive because he has done this to me. And how much I suffered. Only I know how much I suffered. And now he is coming and asking me sorry. I cannot forgive him." Then immediately this doctor asked, "Did you ever suffer from any cracks? Cracks in the anal region, any fissure complaint, or any crack in the corners of the mouth?" Yes. Now what is the medicine? Nitric acid. So nitric acid will not be showing all this revengefulness, hatred and all on the face. Nitric acid is a very nice remedy. It is a very good remedy. Only the keen observing homeopathic physician by his art will be able to delve into the case and find out nitric acid by looking into the keynote symptoms. Yeah. Now, sulfur, lyco, tabacum, Agnes. Okay. Agnes, how is Agnes discouraged? Discouraged to resignation. Agnes, 10 minutes more. I shall go quickly. Agnes is again a very, very negative remedy. Yeah. And very, very syphilitic also. Agnes will be having maybe even cancer also. Mostly cancer of the uterus, cancer of the cervix, where there will be discharge, offensive discharge, swelling, leukorrhea, and the patient can be recovered, but then the patient will not want to recover. No, the patient is surrounded by blue clouds everywhere, like he will be kind of doomed, and the patient is convinced that is DCO, death convinced of. Yeah, I will not survive. I know. 100 times the patient will be saying this every day. I know that I will not survive. Any chemotherapy, any doctor coming and treating me, I know that this is incurable. I know that this cannot be, I will never come back to my normal life. And always in the blues, that is Agnes Castus. That is resignation, no? Resignation towards life. No, I cannot live. Resigned from life. No, I am going to die. That is the thing of Agnes. Then lycopodium. How is lycopodium resignation? Can anybody say? Lycopodium, the need of lycopodium, of course, the power, timidity, discouraged to resignation. Maybe temporarily for lycopodium, because lyco always wants the power, and until certain situation, let me resign. That will be the attitude of lyco. Lyco will never resign completely, but then until this phase is over, let me resign. Discouraged to resignation, because I have to obey, I have to stay here. I have to, I cannot fight back to against this powerful personalities. Maybe in the office, some boss will be there, position loss of, yes, I cannot lose my position, so let me resign, let me stay here. Yeah, whatever, however they are abusing me from the office by the boss or anything, I cannot leave this job and go to another job now. So until this boss is having the transfer or something, let me do the resignation, or let me resign. Not resignation from the job, okay? In that cabin itself, he will remain there, but then he will shut his mouth and he will soft on superiors, no? He will play around and yeah, covered to face the situations. He feels inferior. So until the power comes to his hand, Lyco will go into resignation. Yeah. 5 more minutes left. Any quick questions? Are you all with me? Are you all liking the discussion of the rubrics? Any feedback? Should I work more? Should I change the pattern? Thank you, dears. Thank you, dears. Delusion.
Thank you, ma'am.
Thank you, Divya and Sufaira. So this is like delusion appreciated not, no? From my side. All perfect. Thank you so much, Arya Devi. Yeah. Okay. So I'm asking for feedback. Yeah. Only for more constructions, no? Like now I have been reading now for you people. Thank you so much for that. Otherwise, it will be like just like that into our day-to-day activities and always feeling busy with something or the other. Now finding some time to sit and read so that I'll be able to discuss with you, and discussing is one of the best ways of exchanging knowledge. I get knowledge from you people, and that's how it should be.
Ma'am, one doubt.
Yeah.
Okay, ma'am. One patient approached for weakness. Okay, just now when you told about the remedy, I remembered. She is somewhere around 35 years,
Yeah.
and all of her body is bloated now, swelling kind. Okay, and she feels so much of tiredness. And always her CRP and ESR is raised. So they did all the tests. Every test is normal only. Even finally they did PET scan also. That also it is normal. But from somebody else, I came to know that this girl has an attraction to. She is married with a kid also. The husband is far away. There is always quarrel between husband and wife. It was actually a love marriage, but now there is lot of quarrel and into the verge of divorce. Okay, so there is some counseling is going on and all. So from some other source, I got the information that this girl gets attracted towards men very easily, and not one person, like several other person.
Citric acid.
Even yeah, ma'am. When you told, suddenly it. I thought of citric acid. Okay, ma'am.
Very good. So this is the magic of homeopathy. This is the magic of connecting through homeopathic medicines. Okay. Come up with more doubts. I think there was some doubt in the group. I was very late to open that. I did not see that. Let us discuss that in our next class. Any more doubts or discussions or success cases, please post in the group. No, it will be a motivation for all of us. So that let us call it a day. So bye bye from my side. Let us meet again in the next Thursday classes. Bye, dears. Love you all.